Hi, I'm Rachel Holmes, and this is Wellness in OT. Wellness is the practice of creating healthy habits to attain better physical and mental health. In the field of OT, therapists promote well-being through occupational participation and through health promotion. So every setting is different. I was in a hand therapy setting for my level 2A fieldwork, which would use the biomechanical and the rehabilitation frame of reference. So the biomechanical frame of reference focuses on the impairments that limit occupational engagement and the ways that we can try and facilitate that participation. So this means that the underlying impairment or the underlying disability can be remediated, and this means using occupation, different activities, different tools to try and improve that person's ability. So how is this used in hand therapy? So hand therapy is typically surgery, injuries, tendinitis, just injuries that impact everyday life. So in order to improve those abilities, we use different occupations and activities to promote those skills. We also use the rehabilitative frame of reference. So this is when an impairment is unlikely to be remediated, which can impact occupational engagement. So the focus on this theory is improving the remaining abilities regardless of disability or injury to facilitate occupational participation towards a desired goal, desired function, desired performance. And this is used a lot in hand therapy because there's a lot of conditions that we treated that can't be reversed, so we can try and work with what that person has, such as osteoarthritis, rheumatoid arthritis, strokes, tremors, and lots more. So the type of population in hand therapy is people of all different races, ages, cultures, socioeconomic backgrounds, skill levels, upper extremity injuries, and surgical procedures. However, most of our patients are either surgical, injury, tendinitis, or a chronic condition. To promote wellness, I created plans for my patients to improve their daily functions using home exercise programs and educational handouts. So both of these combined can provide a base of knowledge to give to the patient that he or she can use at home to participate in their desired occupations. So home exercise program includes exercises, stretches, and strengthening that they can do at home with whatever tools they have. And then an education handout is anything that they can look back on that could be used to educate themselves on what the condition is, what they can avoid, what they can do to try and help, and different exercises for that as well. So here are two examples, one of a home exercise program and one of an educational handout with my patient. So one of the ways that we can promote wellness is through education. So one of my projects for fieldwork was to create educational handouts. Basically, it just says what the disease or the impairment is, along with some symptoms, what to do, what not to do, and along with some wrist exercises, stretches, and some proper body mechanics and proper wrist ergonomics for this impairment. So with my patient Peyton, who has lateral epicondylitis, I would show her this handout along with her exercises and stretches, and she could bring this home and use this as a reference. Another way to promote wellness is through home exercise programs. So here we have Roger, who has just had a shoulder surgery and has been cleared to do active assistive range of motion. So here we have his home exercise plan, and we're going to have Roger demonstrate his exercises just to make sure that he knows them. So go ahead, Roger.
Okay. So for the first one I see is this one.
So we're going to do shoulder flexion on a table using a rolly chair. And that's not quite correct, Roger. Let me show you using your HEP. So this is the one that we want. You see, Roger?
Oh,
so instead of leaning on the table, Roger's going to put his hands on the table and use the rolly chair to roll back.
Like this?
Yes. Good form. Good job, Roger.
All right.
Thanks to education and a home exercise program, Roger is now equipped to do his exercises at home.
Thanks so much.